I D D I A. Hi, my name is Addie.
Addie is 9 years old and she's in 4th grade. She has quad cerebral palsy. She has ataxia, she has chorea, dyskinesia, dystonia, and some mild spasticity in little parts of her body.
But the truth is, Addie's a light. I mean, she's full on all the time, loves to go, loves to do things.
She's spunky, she's full of energy and a lot of personality. She can drive her wheelchair so quick. You better watch her toes.
I've known Addie since almost a year now. Through that time, it's been delightful to watch her grow, watch her family overcome some challenges, and to be part of that process.
She has such big aspirations and goals, and just watching her turn into the little personality that she has right now has been amazing and just a joy to watch.
I'll still remember walking through the doors into the medical center and, you know, you're kind of overwhelmed and you just don't know how to feel. You don't know what's going on. But I remember like the care that everyone showed, getting there and seeing the doctors and the nurses in the NICU and just feeling that love and care that everyone provided for Addie.
Kind of when we think about treatment options for patients that have cerebral palsy or even movement disorders, there's a spectrum, right? We think about kind of going from least invasive to most invasive. And so least invasive things would be, you know, physical therapy, physical medicine and rehabilitation folks help with either orthotics and or potentially equipment. And then we also start thinking about medications.
For me personally, I think it was almost at about the age of 2 that I really started to grasp the severity that like, this is going to be a hard life.
I just think of all the possibilities. I think like from the beginning, we didn't know what was possible.
Yeah,
but I think
that's true.
Having a team that did open our eyes to what was possible.
You can have a medical diagnosis like cerebral palsy or epilepsy or any of the other conditions treated at the Justin Institute and still have a developmental disorder and still receive the typical treatment for that disorder. And we really do our best to try to consolidate and make sure that that care is really comprehensive and integrated well.
I think the Institute for Mind Health, they've really been instrumental in just that collaboration among the team. Knowing that, you know, Dr. Accord talks to Dr. Honeycutt and all these different neurologists and all these different doctors, they all know Addie. And she's not some chart, she's not a number. She's Addie, and everyone knows her because they've all talked about her and they've all worked together to develop like a plan of care and how do we give Addie her best life.
Because I mean, like Addie's a puzzle, and all these pieces are part of her, and the doctors have to know all of her, not just some of it.
Here at Cook Children's, our multidisciplinary team approach allows us to have different providers in the clinic all looking at one patient at the same time. We've got social work, we've got orthotists, we've got physical therapists, we have neurologists, developmental pediatricians.
The clinic structure where developmental pediatrics and neurology are collaborating in the same day, in the same clinic space, is novel. I don't know of any other institution in the country that is providing care in this way.
My favorite thing here is all of the amazing doctors and nurses.
The speech therapist was like, we've got to give Addie a voice, and they gave her this iPad. And in my head, I was like, what in the world? You are not giving a screen to a 9-month-old. And they were like, no, a typically developing 9-month-old would start saying 1 to 4 words in the next few months. We're just gonna give her the tools for it.
Over the last few years, Addie has improved significantly, both physically and functionally. She has set goals for herself and hit those goals and just soared past them.
I think that who she is a person full of joy and resilience, intelligence, perseverance, is who she will always be.
We know so many people who aren't given a voice until they're much, much older. I think Cook really believes in empowering these kids. They see the potential at even such a young age.
You know, Addie has these high goals. You know, she wants to be a teacher. I truly think she might be a doctor one day, you know, and I think like they see all that potential in her and they see the possibilities for her and they want to give her the best.
In my office, I actually have a picture that she drew of Cook Children's, and she wrote on the back of it, and that was one of the first times that she'd actually been able to use her stylette to be able to draw and write. It reminds me every day when I look at that picture that sometimes the small things that we take for granted are big things for other people.